diversify the economy of our state, to improve agriculture and agricultural production to a level that it will be mechanized and it can take care of us and others. As I'm talking, Niger State alone has more mechanization than Nigeria as a whole. We have more tractors than the Federal Republic of Nigeria. We have more irrigation facilities than the Federal Republic of Nigeria. We've done a lot in agriculture in an attempt to boost production. Now, we have partners. When we were talking earlier, he said Harvest Plus. We've gone into partnership with Harvest Plus and even ITTI on production of some kind of nutritious maize with a lot of vitamin A's in them, even our cowpea with more nutrients, to boost nutrition in a way that we can have a value chain in nutrition through the maize, the yellow maize, and also the cowpea, the soya, so that the common people can really have nutrition in their diet. Again, this is to the World Bank, to UNICEF, and even the federal government of Nigeria. I was very impressed when the permanent secretary was talking about the strategy for reserve. While you were talking earlier, you spoke about the causes of why malnutrition or famine or hunger is everywhere. It could be as a result of population explosion, natural disasters, climate change, insecurity, economic shock, etc., etc. Yes, these things are factors, but we've studied year in, year out the attitude and characteristics of Nigerian government. When you talk about, and this is the Ministry of Agriculture, you are talking about strategic food reserve. You can't reserve what you don't have. So I think a conversation around what is called reserve. Reserve is extra. Now, there must be a deliberate attempt by the Federal Ministry of Agriculture to either import food to reserve so that they can shock inflation and stabilize price, or, and which is the best, to crop for strategic reserve. As a government, we've written to the Federal Ministry of Agriculture. I'm so surprised that till tomorrow they have not responded, that we have cleared 1 million hectares of land and we are strategically positioned to farm, to crop for the strategic reserve of Federal Government of Nigeria. Now, secondly, the World Food Program also, anytime they come to mop food in Nigeria, inflation skyrockets. They would come with dollars, dollar money, mop the food that is available for the people to consume. Therefore, cause scarcity and crisis in the system. This we have also approached them to say, let us crop for you. And this will solve these problems. So the conversation is, I'm happy it's starting here, but it must continue. We must scale it up. What are the root causes of this crisis? When people don't have food, they will fall sick. When people are well fed, they hardly fall sick. So the symbiotic relationship between nutrition and feeding and health is very critical. So as a state, we are working assiduously in finding solutions to the root causes of this crisis. We have provided solutions to the federal government, especially Federal Ministry of Agriculture, to come in partnership with all the states. Staple crops, there are institutions here who have done a lot of research in adding more nutrients and vitamins to some staple crops that are good, for nutrition. And we have not seen these seeds in the market. What is happening? What is the primary role of Ministry of Agriculture in terms of shocking the gap between demand and supply? The seeds are not there. The inputs are not there. Even if you have money, you cannot find it. So the demand on the people is more than what the people can take. It should be vice versa. The demand should be on the government. And the government here, we're talking about Federal Ministry of Agriculture. They need to step up their game. They are just releasing fertilizers to the people. It's getting late. As a government, we have lost 3 seasons. In this country, we have not done dry season farming in 2023, 2024. This is disastrous. And we're talking about strategic grain reserve. Where are you going to get the grains from? You are not cropping. So we need to sit down and understand how much of land do you need as a federal government of Nigeria in Niger State to crop for you for strategic reserve? How much is going to the market? So, Mr. Osita, I'm very passionate about this issue, and when I come to this kind of program, I hate to take so much time, but I wish this conversation is going to scale up, in a better, in a smaller or larger, forum where we can talk to details. Then finally, the Ministry of Health is doing very, very well in terms of primary health care and also a provision of nutrients or vitamins to people who are under, they call it acute severe malnutrition. Is a very, very important thing. But this is the first stage. I see it as how do I say it? Preliminary stage. There is need for us to be deliberate about this. And being deliberate about this is to work, for example, in Niger State, we have been able to generate data through our primary healthcare centers to understand the gaps between people who are hungry, people who are malnourished, people who are displaced. This data is helping us to understand what we need to invest in our primary healthcare centers. For instance, we provide more of food in our PHCs than medicine. So we make sure that we give 3 square meals to those that are in PHCs than to give them Panadol or paracetamol, because they are not actually sick. They are just hungry. So, that's the medicine. So in the interim, yes, vitamins are very important, but in the long run, people must be fed.